This is omaheke Radio.
The people's voice. The people's voice.
Yes, welcome back. If you are tuning in, you are still listening to me, Dunduka Mushamo, on 96.1. As I said today, we are discussing a very, very, very crucial topic, even though yesterday we have touched based on the topic, which is the Ivermectin Conundrum. And today online, I'm hearing Mr. Links. Welcome to the program once again.
Yes, thanks for having me once again.
Now, yesterday we opened this discussion, but today we want to go more deeper. As you know that people want to know more about the ivermectin. Now, the first question that I will pose to you is, why should the 31 doctors encourage this while the scientists of the product admit that there is no effectiveness of the drug on COVID-19?
I think, I think for most of them, most of the doctors who've signed up to this petition to have this declared an emergency use treatment, for most of them, it is a good faith attempt to try and help their patients, to try and find something that could alleviate whatever their patients are going through, and that's what for me comes through from in this petition that was signed by 31 doctors last week to have ivermectin granted emergency use authorization by the Namibia Medicines Control Council. So I mean, it is sort of this is a desperation move given where we are. For me, this is what it is. It's a desperate attempt to try and get something approved that might help doctors treat their patients. For most of those doctors, I think it's a good faith attempt. But there are some amongst them who, if you go on social media, you see how they've been posting anti-vaccine and and COVID denial posts. So there's very much an anti-vaccine agenda there. For some of them, I say, but for the overwhelming majority, I think it's an attempt to try and get a potential treatment for their patients and see if it works. If it doesn't work, it doesn't work. If it works, it works. That's what they're asking for. So I mean, but what we've seen since then, I mean, the reports we've seen about people buying up the animal version of this drug. So there's a human version and there's an animal version. This is an anti-parasitic medication, and people are going to Agra and so on. It seems and buying the animal version. Because it seems the places like Agra have run out of stocks. So the animal version is not for human consumption, and this is problematic. It could cause problems for people, health problems for people. And the human one, as I understand it, has to be used in dosages which, if you want to, how shall I say? If you really wanted to treat COVID-19 with the human version, you would have to do it at dosages which could become poisonous for humans, because you would have to use so much of the medication. So I mean, the warnings are out there. People ought to be very careful of this. But I think it's from the doctors themselves. It's an attempt to try and find something that
can
could potentially help
the patients.
Yes.
But one thing that me myself I'm failing to understand, like you said yesterday, how would one refuse to go and get a human being proven a vaccine, rather opting to get the animal proven vaccine, which the scientists of the product also said there is no connection between it and curing the COVID-19. For me, it doesn't make any sense.
Yes, I mean, for me, it doesn't. It really is problematic at this point to see, because it creates confusion. People may now think, hey, look, the doctors are saying this thing is we can use this thing, and that's why people go out and go to Agra and these places and buy this. But I mean, this is unproven. People are buying a product, a medication meant for animals,
yes,
and you self-medicating. This could be dangerous for people. And I mean, the whole issue now is it confuses the issue. It creates an impression that there is actually a treatment. This thing is actually an effective treatment. Why isn't government? And you already see these comments online. Why isn't government prescribing this? Why isn't government using this? Does the government want people to die? And these sorts of things.
Yes.
So this thing is unproven as a treatment for COVID-19. Most of what people are using is an animal medication, and it's strange. As we said yesterday, as I said yesterday, it's so strange that people would rather take something that is meant for animals than go and get something that was created for humans.
Yes.
I mean, it is very disturbing. It's very disturbing what's happening at the moment.
Yes.
And what we're seeing, the falsehoods and the like we're seeing, and how the information and communication space is just flooded with all sorts of lies and falsehoods around various things.
Yes.
And then you have doctors stepping into this space and pushing something like this, something which is unproven.
Yes. While we are there, Mr. Links, do you perhaps think these doctors have a hidden agenda in pushing for the drug into the market? Maybe.
I think some of them have. But I think most of them just want to treat their patients. I do think some of them have some other motive. As I said, I think some of them are anti-vaccine vaxxers, have taken anti-vaccine stances. But I think most of them are just looking for something to treat their patients. And Namibia isn't the first country where this has happened around this specific drug. This has happened in South America. This has happened in India recently. So I mean, it is problematic, to say the least. That things like these are happening at a time when we really don't need there to be any confusion about the messaging that should be communicated to people. That people should get the vaccine. The vaccines are safe and effective. So I mean, I think this is it just complicates things, and it's really unnecessary.
If you are still tuning in, or if you are just tuning in, we are talking to Mr. Frederico Links from the Namibian Fact Check, and today we are discussing the Ivermectin medicine that is meant for animals, but people are opting to be vaccinated by it. And there are some doctors, 31 doctors, that wrote a petition so that they can, the government can approve, so that they can start prescribing this medicine to their patients. Now, what do you think the doctors in both the public and private sector can do to help decrease COVID-19 disinformation?
I think the communication around the vaccine needs to improve, and I think the Ministry of Health should lead this effort. And that they should really try and get all doctors and health workers on the same message around vaccines, and try and have everybody speak from the same page about vaccines to reassure Namibians, ordinary people out there around the country, that the vaccines are safe and effective, and they're going to help us get back to some sort of normal. This is what has happened in other parts of the world, what is busy happening in parts of the world. So we really ought to get, they really ought to speak to the healthcare sector,
yes.
and speak and have the healthcare sector lead on messaging, not people like you and me. I mean, we shouldn't be doing these things.
Yes, I think they must put a regulation which will become effective in terms of information sharing.
Exactly.
Yes.
There needs to be a lot more transparency around the information around the vaccines and what's happening in COVID with our COVID-19 situation. And it should have happened yesterday. Because by now people have and we're seeing this, by now people are so exposed to all the falsehoods and lies
yes.
Around the vaccines. I mean, I spoke to somebody this morning who told me straight out, they don't believe anything I'm saying. I said, what can I do? This is what the credible sources, this is what the experts are saying. It's not me.
Yes.
It's not me saying these things. Go and look at what they're saying. Go to their website. Go and look at the information they're putting out there. And it's not me. So I mean, these sorts of things shouldn't be me and you spreading the messages. We should just be the channels for the messages. But I mean, we have a situation where these things aren't being addressed by health authorities, where the falsehoods and the lies aren't being counted by health authorities. I mean, it really is. It really is not, especially at this time. We can actually see the impact of all these falsehoods and lies on people. Exactly when we want people to have trust in the medical profession, in the medications and the treatments and the vaccines that are out there.
Yes. Before we end this program, there is a SMS that came through from a person called Kevin from Kanansi. He is saying, "Thank you very much, Edwin and Mr. Links, for always updating and letting us know what is right and what is not right. Please make sure you have Mr. Links each and every Friday on the program." That's just a compliment that came from a listener.
Thank you very much.
Thank you. It is always, as I'm saying, it is always a pleasure for you to be here sharing the information to our loyal listeners so that they can choose what is right for them and for their health.
Thank you. It's always a pleasure, and I look forward to being on the show again.
Thank you very much. That was Mr. Frederico Collins from the Namibian Fact Check as we debunk the myth around COVID-19. From me, Tunduka Mushemo, until next week, Friday, it's bye-bye.
This is omaheke Radio.
The people's voice. People's voice.